brick building with a damaged roof now. It was a vacated school, of course, because of the desegregation order. There weren't any white kids in Cary, Mississippi, so all the children in Cary, Mississippi had to be bused to Rolling Fork, 13 miles down the road, so they could go to school with a couple of white kids. So the town fathers said, why don't you just use the school building for your clinic? Wow, a 5-room brick building. So we got some friends from Northwest Iowa to go down there and put on a new roof, and there we had it, a 50-year lease at $1 a year. It meant that not only could we have a pediatric clinic, but we could do all kinds of Christian community development at the Cary Christian Center. Not only that, we sent a letter out to everyone in our denomination saying, we've had a disaster, our clinic has been destroyed. We took in so much money that we ran that Cary Christian Center for the next 5 years with the response that we got from that letter. God works in a mysterious way, his wonders to perform. Now, I know you all think that you've heard all of the good news, but you haven't heard the best news. Because John Perkins in Mendenhall, Mississippi, heard what had happened in Cary, and he came and he said, I want one of these too. And that was it. You know, Craig, when he introduced me to talk about all these awards I get, the best award I've ever gotten in my whole life occurred here yesterday when John Perkins announced to CCHF that Gary Vander Ark was his best friend. You know, I can't begin to tell you what a wonderful, wonderful relation we have had for 36 years, where I think in many ways we are blessings to each other. John Perkins has made such a difference in my life. Back to my life, you know, I spent 10 years in Ann Arbor in medical school, and then 6 years as training as a neurosurgeon. Then I spent 3 years at Walter Reed in the Army, serving my country. Then I moved to Denver, Colorado to begin the neurosurgical service at the City Hospital, the most wonderful city hospital in any metropolitan area in the United States, Denver General, now called Denver Health. And then after 6 years, I discovered that there were actually neurosurgeons that operated during the day. So I went into private practice, and an incredibly awful thing happened. At age, I must have been 42, 43 by then, middle-aged, and for the first time in my life, I discovered that in the United States of America, it makes a difference if you have money or if you have health insurance. And I said, this must not be. So I set out to change that. And I haven't made much progress after all these years. But in 1985, a couple of suburban hospital administrators came to me. They came to me because I was president of the County Medical Society, and they said, you've got to do something about the fact that our hospital emergency departments are overrun with uninsured people. So I said, okay. if I organize the doctors and we take care of them, will you provide the expensive things like inpatient care, like imaging studies, like lab studies, and so on? And they said, yes, we will, if you keep them out of the emergency room. So we organized the doctors of the Arapahoe Medical Society, and we began taking care of the poor people in South Denver. We've done that now for 23 years. Our program has grown. Last year, we exceeded 800 physicians participating in our program. We now have 5 hospitals, and with the recession, last year we provided more than $20 million in free care to the poor people living in South Denver. And then in 1995, I got a call from the president of the State Medical Society. He said, I just want to tell you, Gary, that your committee on the medically indigent has been sunset. We won't need you anymore. And I said, you can't do that. It's the most important committee the Medical Society has. He said, well, we did. So that meant I had to run for president of the State Medical Society. I ran on a one-plank platform. It was the Medical Society must do something about the medically underserved. And guess what? I lost. But I'm persistent, if nothing else. So I ran again the next year and I was elected. And the Medical Society said, okay, what are we going to do now? And so we established the Colorado Coalition for the Medically Underserved. It has made a difference. The legislature does listen to us. The governor listens to us. We do education, advocacy, and facilitation, but we still haven't solved the problem of the medically underserved in Colorado. So back to justice. Yes, the word of the Lord is right and true. He is faithful in all he does. The Lord loves righteousness and justice. The earth is full of his unfailing love. The Bible is very clear about justice, but we don't have it. The United States of America, we have the best health care in the world, don't we? Well, depends who you ask, I guess. Certainly, the World Health Organization doesn't think so. They rank us 37th. That's right between Costa Rica and Slovenia. How about the Commonwealth Fund? What do they have to say? Well, they looked at things like quality, equity, efficiency, access, and gave us a 66. That's a failing grade. In the past 2 years, 1 out of 3 Americans report a medication, medical, or lab test mistake. Commonwealth Fund says if we fix things, we could save 150,000 lives and $100 billion annually. Oh, yes. We do. The Institutes of Medicine say we have a problem too. They think at least 20,000 people a year die because they do not have health insurance. That's 1 every 10 minutes in the United States. But we do rank number 1 in one thing. Are we getting our money's worth? According to the RAND Corporation study, 55% of the time when you go to see your doctor, you get the right treatment. But it's worse if you're a child. If you're a child, you get the right treatment 49% of the time. It's been judged that 1/3 of all Medicare spending doesn't have any effect on health care. Why do we